Hello all. So in this session, we are going to discuss about the electroconduction system of heart. So what is cardiac contraction? It is the contraction of the heart muscles and relaxation of the heart muscles. Both this cardiac contraction and relaxation will result in a heartbeat. So what causes this contraction relaxation? It is an electric impulse generated somehow in the heart muscle. So this electric impulse is generated by a node known as sinoatrial node. So it is kept at the topmost portion of the right atrium or at the entry junction of the superior vena cava. The impulse generated by the sinoatrial node or SA node is then passed on to AV node or atrioventricular node, which is kept at the junction of right atrium and left atrium. The sinoatrial node is also known as a pacemaker of heart because it is the node that will generate the impulse which is responsible for the cardiac cycle. Now, the impulse after reaching the atrioventricular node, it will move on to a bundle of nervous tissue which extends from this AV node to both the sides of the heart, that is to the left side and right side of the heart. This bundle of nervous tissue is known as bundle of His. And from this bundle of his, the impulse then passed over to several branches which extends to the ventricular muscles, both the right ventricular and left ventricular muscles or myocardium of the heart. This branches of fibers from extend from the bundle of his is known as Purkinje fibers. Now, when the impulse reaches this Purkinje fibers, the contraction of the ventricles takes place. So this is how the electrical signal conduction is taking place inside the heart. Now, a cardiologist will look at the heart rate for diagnosis depending upon the number of heartbeats per minute. A normal value of heart rate lie in the 60 to 100 beats per minute. Now, if the heartbeat rate is lower than this value, it is known as bradycardia, and if the heart rate per minute is greater than this value, that is above 100, then it is known as tachycardia. Now, the heart rate cycles are evenly spaced if not evenly spaced, then that condition of heart is known as arrhythmia. So these are the three conditions of the heart that can be diagnosed by a cardiologist just by looking onto the number of heartbeats per minute. Now, as I have told, the electrical signal produced by the sinoatrial node is conducted through AV node, bundle of His and Purkinje fibers and at last result in contraction of ventricular muscles. So this is due to a conduction of electrical current from the SA node to the myocardium. So the tracing of this electrical current is to be done in order to understand the condition of the heart. So the tracing of this electrical current or impulse is done by an instrument known as electrocardiograph, and the tracing or a graphical recording of the electrical current or impulse is known as electrocardiogram or ECG. An ECG, a typical ECG consists of several peaks known as P, Q, R, S and T, and this is the typical ECG waveform. Here you can see several peaks P, Q, R, S and T, and there will be corresponding voltage corresponding to each of this peak. Corresponding to P, there will be a voltage for a normal heart. Corresponding to R, Q, S and T, there will be voltage. Also, the duration also will be there for P, Q, S, T. Also between this P and Q, P and R, Q and R, Q and S, S and T. All this there will be a duration. So these amplitudes and duration of a normal human heart ECG is recorded by a cardiologist, and it is then compared to a patient's ECG and the disease is diagnosed. So these are the various amplitudes and durations of each of the peak of a normal human heart from the ECG. Normal human heart ECG amplitudes and duration is given by this. Okay. So if any deviation from this amplitude and duration, then comparing those deviation, the disease is diagnosed. Now, there are several pathogenic conditions that may occur due to the variations in ECG. This includes altered paths of excitation of heart, that is due to the difference in the electroconduction system. Some pathological conditions may occur. Second one, changed origin of waves. Okay, that is the waves of beats are origin from SA node actually, but if there is a change in this origin of beat, that is if you are implanting some artificial a pacemaker I know, then there is some pathological conditions may occur or difference in normal functioning may occur. Third one, altered relationships of features. Fourth one, change in magnitudes of one or more features. Fifth one, differing durations of waves and intervals. The fourth and fifth condition I have discussed before, that is change in amplitudes and time period of the different peaks of the ECG. Okay, so and there is some more thing about the position of the heart. The heart, as we know, is located in thoracic cavity, and the location where a heart is situated is known as electrical axis because it is an axis where greatest electromotive force is developed at a given instant during a cardiac cycle. And during each cardiac cycle, this electrical axis will get shifted continuously through a repeatable pattern in a rhythmic pattern. So the variation to this rhythmic pattern of this electrical axis also is a pathogenic. Okay, now this electrocardiogram or ECG is recorded by an electrocardiograph by positioning different electrodes at different locations of a human body. Okay, and the electrodes that record the electrical activity are placed at 10 different locations, one on each of the four limbs and 6 at different locations of the anterior surface of the chest. After placing these electrodes, then the standardizing of the electrocardiograms is done, and then the standardized ECG is then compared from time to time in the same person. That is, at first a normal ECG, standardized ECG is recorded, and after a few days his ECG is again recorded and is compared with the standardized ECG, and depending upon that the disease can be diagnosed. Now, the normal electrocardiogram shows typical upward and downward deflections that reflect the alternate contraction of the atria and the two chambers or ventricles of the heart. The first upward deflection P is due to atrial contraction and is known as atrial complex, and the other deflections Q, R, S and T are all due to the action of ventricles and are known as ventricular complexes. Any deviation from the particular electrocardiogram is indicative of a possible heart disorder. Okay, so these are about the electrocardiography and electroconduction system of heart. In next session, let us discuss about the electrodes and lead.